So today's video is about quadruped rocking. I've had a video demonstrating the movement, but I've not actually spoken about it a lot. It's a very useful exercise because it's very accessible for everyone. So even for people who are not very flexible, who are not very strong, who are in a lot of pain, they can use it. So this is a very foundational movement, and you can use this movement to prepare to become stronger, prepare to become flexible. So quite a few of the problems that we face are shoulder pain, hip pain, and back pain. And in order to mobilize these areas without a lot of suffering, in order to make them stronger, the standard advice is usually to try and get the hip more mobile and the shoulder more mobile and the spine under better control. And the standard exercises that you do in the gym are usually out of reach for most of our patients. So we ask them to do something that's a lot more accessible, which is the quadruped rocking. Now the quadruped rocking is, as its name implies, you're standing on all fours, quadruped, and then you're going to rock forwards and backwards. Things to remember: your elbow needs to be straight. So as you go back, your elbow stays straight. You will not let it bend that way. You need to keep your elbow straight. And this is a smooth movement. You shouldn't use any force. It's pretty much like you're on a swing, or if you're playing with children, you're going to be rocking forwards and backwards. And if you're in pain, you'll obviously move slower. You'll be a lot more careful. And as you rock, the pain will continue to reduce. And as the pain reduces, you can start to increase the depth to which you rock backwards, and you can increase the speed with which you rock backwards. It's important that you emphasize the backwards movement more than the forwards. It's usually enough if you come just to vertical. There's no real reason to go forward when you're in pain. So going backwards as far as possible without pain, and then coming forwards again. The pausing is used only if you're in pain. Now the other thing that you need to remember is, as you go backwards, I want you to inhale, and when you come forward, you exhale again. Inhale, exhale. And the rep set scheme for this is, I would like this exercise to be done twice a day if possible, 25 to 50 times. It doesn't take a very long time. It'll take you 2 to 3 minutes to rock forwards and backwards 50 times. So it's a very minor investment for a lot of benefits. So this is going to improve your shoulder health, your hip health, your core control, and your synchronization of the diaphragm with your shoulder and your hips, which is very important in preventing future injuries. So even if you're not in pain, if you want to prevent future pain, this is a good exercise to do. And I think everyone should be doing this exercise on a daily basis, especially if you spend a lot of time sitting, or if you spend a lot of time without movement. So quadruped rocking, start doing it on a daily basis and let me know how it goes for you. Thanks.